For the enhanced auricular acupuncture protocol, it's very important to be precise with the needle placement. So understanding the ear anatomy is actually very important since the ear is quite small. So if we look at this picture right here, the outer rim of the ear is known as the helix of the ear. So that's labeled 1. 2 is this prominent ridge right here known as the antehelix, and that goes all the way up to the letter A, which is the superior crus, as well as B, which is the inferior crus. In between these two structures is number 3, which is known as the triangular fossa. Shenmen is actually in this triangular fossa and is actually a very important point that we're going to talk about later. The tragus is labeled 4 and its mirror is the antitragus 5. And in between these two is the intertragus notch. The root of the ear, as we follow the helix all the way down to the root here, there's a little notch here that's a little bit difficult to see on this 2D model. But believe me when I say it's there, and that's labeled number 7. Point 0 is actually at that notch. And again, a very important point. And then the superior concha, which is labeled 8, and then inferior concha, which is labeled 9. So the first point we're going to talk about is hypothalamus. That is located on the antitragus here on this little plateau area. That's kind of difficult to see on a 2D model, but a little bit easier on a 3D model. This is the only needle that's going to go in a parallel fashion to the entire pinna, which is the whole outer ear here. So it's the only one that's going to be in a parallel fashion. Everything else from now on is going to be in a perpendicular fashion to it. So if we take hypothalamus as the midline here, if we draw a line all the way down and call that midline, right off of the cartilaginous ridge right here on the medial side is amygdala. So again, midline right here on the medial side, right off of the cartilaginous ridge into the meaty portion of the lobe, that's amygdala. The next point is on the lateral side. So again, hypothalamus here, you draw it down midline right off of the cartilaginous point, off of the cartilaginous ridge, right in the meaty portion of the ear, right here, that's hippocampus. Prefrontal cortex is where the cheek meets the ear right here. If you draw the intertragus notch all the way down, this line right here, this whole area is prefrontal cortex. Master cerebral, which is a secondary master point, is right in the center here. And that's the one I typically take simply because you might as well get as biggest bang for your buck if you're going to take a point. Point 0, if you follow the helix of the ear all the way around down to the root, there's a little notch right there. Again, difficult to see on this 2D model, but there's a little notch right there, and that's known as point 0. Shenmen is between the superior crus and the inferior crus right here. Again, this is the antihelix, so superior crus, inferior crus. And in the triangular fossa right here, in this corner, is Shenmen. So insula is what I call completing the triangle point. If you look at the intertragus notch right here and this little mountain on the antitragus and draw a line out to where the second ear piercing is in most people, that's insula. And vagus is right next to the tragus, vagus tragus, right next to the tragus, but right at the base of the ear, right before it gets into the ear canal. So it's the don't put it in the ear canal point is what I refer to it. So it's a very fast and very brief description of the points that we use for enhanced auricular trauma protocol to help with pain control, nausea, vomiting, as well as any anxiety in patients that we see intraoperatively.